Good morning, everyone. I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. Cardiovascular disease is the number one killer of men and women in the United States. In my practice as a cardiovascular and thoracic surgeon and a cholesterol expert, I've had a large number of female patients who really do not know the extent of heart disease in women. Somehow they think it only affects men. Many postmenopausal women are told by their primary care physician that if they take estrogen replacement therapy that they're protected from heart disease, as premenopausal women who make their own estrogen are. Also, I've noticed that on social media, many influencers who are not medical doctors are pushing estrogen in postmenopausal women to treat high cholesterol and prevent heart attacks. Not for the symptoms of menopause, but nothing could be further from the truth. It is frightening that so many physicians still believe this falsehood that estrogen is protective in postmenopausal women from cardiovascular disease. So prior to 1998, estrogen replacement was a standard part of cardiovascular prevention regimens in postmenopausal women. It was thought that estrogen helped prevent the blockages, the plaques in the arteries from breaking, and this is a major cause of heart attack and stroke. Well, real progress in both our understanding of cardiovascular disease and making therapeutic decisions in women began in the late 1990s as randomized clinical trial data in humans started to emerge. These trials included both primary and secondary prevention settings, in other words, preventing the first or the second event. Data from the giant Women's Health Initiative looked at over 27,000 postmenopausal women and failed to detect any cardioprotection from estrogen. In contrast to other therapies like statins, which lowered cholesterol, have demonstrated an improved ability to improve cardiovascular outcome in women. So our previous beliefs based on this observational data or from men's trials had to undergo a radical rethinking. After data from randomized trials that I just described, guidelines from the American Heart Association and American College of Cardiology have refocused efforts on how to accurately assess risk and to prevent and treat atherosclerosis with evidence-based therapies, because that's what matters from randomized clinical trials. All of these organizations have removed estrogen from the list of therapeutic modalities which should be used for cardioprotection. In addition, current guidelines from the U.S. Preventative Task Force, the American Heart Association, and the Menopausal Society do not recommend estrogen or hormone therapy for the primary or secondary prevention of cardiovascular disease in postmenopausal women. So with that said, I hope you learned something today. For guidance on this topic or any other medical guidance or a lipid consultation, you can go to my website at www.paladinmds.com. And thank you for listening, and I hope you have a great day.